Good evening, everyone. My name is Tanya Hedges. I'm the nurse manager at Illinois Department of Public Health in the Medical Cannabis Division. I am a nurse. I've been a nurse for 28 years now. I've covered just about every aspect of the lifespan. Was a labor and delivery nurse for a while. I've done surgery. I've done oncology clinics, so I've kind of been a nurse across the lifespan, but I've only been with the Medical Cannabis Division since September of 2021, and I love it here. We have a great group of people. Our division chief was not able to be with us tonight. His name is Miles Willingham, but he's also a big advocate, and we're just thrilled that you've joined us tonight. He's a veteran, and he's also a nurse, so we have two nurses in the administrative positions here, and we're thriving to grow our program. And so we're happy to be here tonight to share some information. The first slide, you can go ahead and next slide. I'd like to give you a little bit of an overview of the cannabis program. The cannabis in the state of Illinois, it's divided into 16 different categories. There's three primary cannabis regulatory agencies, and there's the Department of Financial and Professional Regulation. That's the department that regulates all of the dispensaries. We have the Department of Agriculture. They regulate the cultivation sites, and then we're housed within the Department of Public Health, and we regulate the patient program. So that's what we're going to be discussing tonight. And then as an umbrella over this whole group, we have what's called the CREW, or it's the Cannabis Regulatory Organization. Okay, so the history is that medical cannabis was signed into law in August of 2013 as medical cannabis, and then effective January 1st, 2020, recreational cannabis became legal in the state of Illinois. IDPH's mission is to protect the health and wellness of the people in Illinois through prevention, health promotion, regulation, and the control of disease and injury. And that's why we want to give you this education tonight as a form of public service. Next slide. So this slide here shows you a little overview of our medical cannabis. We have approximately 135,000 patients in our medical cannabis patient program. You can see in this pie chart that 81% of those patients are our adult medical cannabis patients. That's what the MCPP stands for. And then 8% are our caregivers, and we'll discuss what the caregivers are. But we do have over 10,000 caregivers in our program, and then we have approximately 3,000 providers, healthcare providers, active in our program, and those are the providers that would certify a patient. You can see our OAPP, that's our opioid alternative program. We'll talk more about that on a separate slide. That is approximately 2%. And then we have our minor patients, which are our patients that are involved in our program that are under the age of 18. Next slide. This slide shows you the qualifying conditions. We have 52 medical conditions that can qualify someone to be approved for a medical cannabis patient card. You can see there's a plethora of those. We've got them all lumped together with the pediatric population and the adult population. But we currently have 52 conditions, and then there is a process to petition if there's a condition that a patient would feel like they could benefit, or they've used medical cannabis and the condition's not currently one of our qualifying conditions. There is a petition process that is on our website, the IDPH website, that can tell you more about that, how you can discuss that with your provider and petition to get that included in our list of conditions that we have. Next slide. So our qualifying conditions data, so the debilitating conditions with the highest number of diagnosis, the highest number that we have in our adult population that comprises our medical cannabis patients is chronic pain. That's about 31%. And then post-traumatic stress disorder. We see that with our adult population. We see a large majority of our veterans. That's the diagnosis that we see most often. And then migraines, osteoarthritis, and cancer. And these are the highest numbers in the adult population. So on the next slide, we have our types of qualifying patients. We have the adult population, we have the veterans, we have terminal patients, pediatric patients, and then the opioid alternative. And I'm going to go into each one of those categories separately on the next few slides. So our veteran qualifying patients, there's two ways a veteran can qualify for our medical cannabis patient program. If you're being seen by a civilian doctor, which is any doctor that's not associated with the VA, you can go see a doctor that certifies. It's called a provider certification. Or we offer our veterans to give them access to care. If they're seeing a doctor within a VA facility, they typically will not certify patients because of medical cannabis not being federally legal at this point. So we do allow our veteran patients to upload a year's worth of their VA medical records from their visits that they've seen with the doctor. And we look for the medical conditions to be included in there. We look that a veteran has had ongoing care in the past year. And then our veterans can qualify for a 1, 2, or 3-year card. And we do give them a reduced fee of $25 a year. And to qualify for that reduced fee, anytime you want to use vet records or use your veteran status, you do have to upload a DD 214 that includes the character of service at the time you were discharged. We just recently we're able to make an amendment to offer a lifelong certification. And what that means is if you have a condition, medical condition that's considered to be lifelong, you're going to have it throughout your life. We can make that determination based on the medical records, and then you would not have to upload those documents again when you recertify. Next slide. On this slide, we talk about our terminal qualifying patients. So to qualify as a terminal patient, you have to have a medical diagnosis with a life expectancy of 6 months or less. You have to see a doctor. A doctor has to deem you as a terminal patient. With that, you can get a 6-month card at no charge. There's no cost to the patient, but there's also no option to renew. So if you have a diagnosis and you would have a your lifespan would go past that 6 months, you wouldn't be able to submit for a free 6-month card again, but you would be able to go ahead and submit for a medical cannabis card. And primarily cancer diagnosis are the ones we see most often with those terminal applications, but there is an option for the doctor to mark other as a terminal disease. For example, we'll sometimes get people who are in stage renal disease, in stage COPD. The COPD and the renal disease are not in our 52 qualifying conditions for the average population, but if you're in the end stage of that with a life expectancy of 6 months or less, a doctor can use that diagnosis. Next slide. Okay, so our pediatric minor qualifying patients, our program defines pediatric as anyone under the age of 18. You can qualify for a 1, 2, or 3-year long card. There is an option to be deemed lifelong by the pediatrician or the doctor that is providing the care for the pediatric patient. And a big difference with this is we do require that there's a provider certification from a doctor who's seeing this patient regularly. And then we also have to have a second doctor review that and also agree with the certification. So we do have the 2 certifications that go along with the pediatric population. And one thing I do want to mention, we do get questions where a patient has had a pediatric card and then they age out, which means they've turned 18. Once the child turns 18, they do have to reapply and upload everything again. It's not that it just completely transfers over from the minor card. And also, if they have a card as a pediatric patient and they turn 18, but the card doesn't expire, say they did it at 16 years old and they got a 3-year card, they can continue to use that minor card, but with that, they cannot purchase certain things at the dispensary, such as smokables. Okay, next slide. So this shows our qualifying patients by condition for our pediatric data. Autism is the diagnosis we see most often in the pediatric population. And then post-traumatic stress disorder, seizures, cancer, chronic pain, and you can go on down the list and see, but autism is almost 50% of the pediatric patients that we have. Next slide. Our adult qualifying patients are anyone who are over the age of 18 and over. 1, 2, or 3 year cards are an option. Someone can do a 1 year card. I don't think we mentioned that in the slide, but if you do a 1 year card, you can extend up to 3 years. So there is that option as well. You just pay the additional fees, but you can extend the card. With the adults, we have the lifelong option. It's not that the patient cannot deem themselves as a lifelong condition. It's totally up to the discretion of the doctor who's certifying them. But if the doctor marks that you're lifelong on that first certification that you have with them, you would not have to get a provider certification again in 3 years when your card expires. There are discounted rates for our adult patients on Social Security or disability benefits. We do have in our application process, there's just, it specifies what documents you have to provide. Most commonly, we expect to see in a BVL, a benefit verification letter that you would get to show that you're disabled. And then you do get the reduced fee, which would be $25. So our adult qualifying patient data on the next slide. You can see that this is an interesting slide. There's a lot more research that needs to be done in the world of medical cannabis. And again, with the federal legalization, there's some constrictions put on that at this time, but you can kind of see something interesting in this graph. It shows that the younger adult population that under the age of 30, males more often are in the medical cannabis or using medical cannabis. And then as they hit about 50, the averages or the percentages sway the other direction, and the female population have a higher percentage. My personal opinion, and I don't have any research to back this, so that's my disclaimer, is it could be possibly maybe related to the conditions that a woman faces as the result of menopause. Migraines is on our list of qualifying conditions. Osteoarthritis is on there, fibromyalgia, chronic pain. So that's just my own personal opinion, what that might be. And I'd be interested to hear if anyone else had any other thoughts about that. Next slide. We're going to talk about the opioid alternative program. That's the OAPP that you see on these slides. With the opioid alternative program, this is geared towards those patients who have chronic pain, have been on an opioid prescription, or you can also qualify if you have a medical diagnosis, but you may not be on an opioid. You know, the doctors stated that you have, severe chronic pain or something that would typically be prescribed an opioid. With that, you get a 3-month card for $10. It's also a good option for someone if they want to just try medical cannabis to see if it helps their condition. It gives you a 3-month card for $10. And the criteria is to have an active opioid prescription or a diagnosis that would qualify you to have a prescription. It's also a good option if you've currently had a surgery, if you're having that acute period where you've got post-op pain. It's an excellent option to try the opioid alternative program so that you're using medical cannabis versus the high addiction rate of opioids. We've seen a significant decrease in OAPP since chronic pain was added to our list of qualifying conditions to get a medical cannabis patient card, the MCPP program. So you can see the significant decline, and that's what it was. It's about the time it went from 1,932 down to 803 people patients in our OAPP program at this time. But with the opioid pandemic that's going on in our country, we expect that this program will grow again, and hopefully we'll have more people that we can help, get them off opioids by using medical cannabis. Next slide. Okay, so our caregivers. Patients are permitted up to 3 caregivers. There is a fee for caregivers. It's $25 per caregiver. Caregivers can purchase, transport, and administer medication for patients, but they may not grow cannabis plants for the patient. Only patients can grow plants. A person can only be a caregiver for one patient at a time. Now, pediatric patients, we do give them one free caregiver with their card because they're a pediatric patient and they need to have an adult. We've had some special circumstances where maybe a family has twins and they're both needing medical cannabis for a seizure disorder, and we have made exceptions for that, you know, we can have a caregiver for more than one patient. But for the adult population, it's up to 3 caregivers for a patient, but a caregiver can only be a caregiver for one patient. You can't be a caregiver for, you know, 5 or 6 different patients. Next slide. Okay, so waivers. What are waivers? So waivers is something that if your healthcare provider has this, you know, you meet with your healthcare provider and patients start out at 2.5 ounces every 2 weeks is what their allotment is. If 2.5 ounces is not meeting the needs to help control the medical symptoms that they're having, then the provider can submit a waiver to request that they get an increase in the allotment. Most prevalently, we see 2.5 to 5. If we see a big jump from 2.5 to 10 or 15 in the request, we're going to question that because just like any other medication, it should be tapered slowly. It shouldn't be, you know, start high and go low. You start low and you kind of build up as you need it. The waiver does have to come from the provider who has certified the patient. That's something that we look at. If a provider certifies a patient for medical cannabis, you can't go to another provider to ask them to do a waiver. We do look to make sure that the waiver is coming from the doctor who certified them to begin with. Waiver requests have to specify the medical necessity for the increase in the allotment, and they can't just use the diagnosis. It can't just say PTSD or chronic pain. It has to say why the 2.5 ounces is not sufficient to meet their medical needs. Some of the common reasons we see waivers in asking for increased allotments are RSO usage, the concentrates. Those are the things that take up a big part of the allotment. And so people tend to run out of their medication before the 2 weeks is up. Some people cook and make edibles at home, and that takes up a big part of their allotment. Or they're trying to treat multiple conditions. Say someone has chronic pain, migraines, and osteoarthritis. They may need a higher amount, and the doctor would have to submit the waiver for that. You can go ahead and go to the next slide. Okay, so now we're going to get into some definitions. So CBD, the cannabidiol, non-intoxicating compound found in cannabis and hemp. It helps with neuropathic and inflammatory pain. When treating pain, it is recommended to use it's sometimes recommended to use combination CBD and a THC product. We're not advocating for any particular products or going too far in depth. I just want to give a little bit of an overview of what the different types are. CBN is a non-intoxicating compound as well. It's created through aging of the cannabis, letting it get old and kind of break down. And it's topically used for conditions such as psoriasis or burns. Next slide. Different routes of administration or consumption. If you think of medical cannabis, just like any other medication, there's different ways you can take it. You can inhale it with the flower or the concentrates or the vape pens. Orally, there's pills, lozenges, drinks, food, RSO concentrates. Sublingually, there's the option of tinctures and sprays. And then for some of the pelvic diseases, suppositories work really well for things that, you know, in that area of the body. Topicals, they have lotions, balms, and even bath salts. You can go to the next page. Edibles, we have different types. Well, we don't have different types. There's different types out there. Baked goods such as brownies, drinks, tablets. There's even things like taco seasonings that come in a packet. There's gummies, chocolates. I mean, there's a huge variety of things that can come in an edible form. In Illinois, the maximum dose is 100 milligrams per edible. Some patients with absorption issues like GI issues, cancer, Crohn's disease would require larger doses. because they don't absorb it. Just like any other medication, they don't absorb it as well if they have those kind of conditions. So that might be another reason someone may need an increase in their allotment, that the doctor could submit a waiver. Next slide. So the tinctures are alcohol-based cannabis extracts that medical patients use to accurately and discreetly dose themselves throughout the day. Tinctures are popular with diabetics because of the sugar content. You have to worry about that when you're diabetic. That way they don't have to use an edible route that would probably have more sugar in it. They're typically dosed under the tongue, although some people will even put them in a smoothie or some other type of beverage. Next slide. Topicals. So topicals can come in infused lotions, balms, and oils. They're typically used for muscle soreness and anytime you want to use it in a localized part of the body. So for localized pain relief, tension, psoriasis, dermatitis, some people put it on their forehead for headaches or on their abdomens for cramping. Next slide. Okay, so for cannabis, medical cannabis uses in pain, as we discussed, topicals like your lotions, balms, and oils used for muscle-related pain. There's transdermal compounds used for bone-related pain. Those reach in a little further than just your topical. They are a little harder to find in the dispensaries. Orals, there's a THC, CBD combination related products, work well for pain when you're using medical cannabis. And then inhalation, terpenes, which is a part of the cannabis plant, can help alleviate the THC and provide or help elevate the THC and provide a greater relief. So something we didn't really touch on, but we'll talk about it quickly. I thought it was on one of the slides. Delta 8 versus Delta 9. I don't think there's a slide. I just want to point out Delta 8 is what you would find in like your gas station. It is not regulated. We do not recommend patients use that. You don't know what you're going to get because it's not regulated well, or actually regulated at all. If you go into the dispensary, what you're going to find is Delta 9. So I did want to point that out, that's something you hear a lot about in the news. And the complications from Delta 8. So I just wanted to point that out. Next slide, please. Okay, so you have all this information now and you're wondering, well, if I can purchase in any dispensary, why should I pay for a card to get medical cannabis? So if you have a card as a medical cannabis patient, you've been certified that you have a qualifying medical condition to use it. It does help give you some workplace protection for patients. The compassionate use of medical cannabis provides discrimination protection for medical patients from school, employment, medical care, including organ transplant, custody, visitation, landlord, leasing, and government assistance. Now, that being said, you cannot be a medical cannabis patient if you hold a CDL license, if you drive a school bus, those kind of things. Those are just state rules. We do have to run all of our applications when people apply are ran through the Secretary of State. And if there is a CDL license on file, it will reject it. So, and we will sometimes get calls and people will ask, I'm applying for a new job. I have to do a drug test. I'm a medical cannabis patient. Is this going to prevent me from getting a job? We don't have any jurisdiction over their actual hiring practices. It's just, if you have a medical cannabis card, you do have some other protections. Next slide. And the greatest reason for a medical cannabis patient card and for someone to get a card is they do not pay the 20 to 40% taxes in the dispensaries that are tacked on top of the products when they're on the recreational menu. Medical and recreational users have access to both menus. They can buy off the medical menu and the recreational menu, but not all products that are on the medical menu can legally be sold on the recreational menu. If you think about it as a medical patient, if you have a diagnosis, you have a lot of pain, you're going to need something a little more concentrated, a little stronger. So only you would have access as a medical cannabis patient to some of the things that are on that menu. And again, you are allowed to grow up to 5 plants in the home. Now, if 2 people live in the same home and they're both medical cannabis patients, it's still only 5 plants total. It's not 5 plants per person. So that's a big question we get, and you're permitted to grow 5 plants in your home. Again, your caregiver cannot grow it for you. If the caregiver's in the same home, then that's the medical patient lives there. That's where the 5 plants are. Next slide. So this is what we do. This is why we're here. We are the Medical Cannabis Patient Program. We review the applications. We make the determinations whether you meet the requirements to get the card. So if you would like to apply, I'm just going to kind of do an overview. You would have to schedule an appointment with your primary care doctor, and if your primary care doctor is not someone who certifies patients for medical cannabis, you would have to do the research and find a provider who would do that for you. We do not provide a list here at IDPH of doctors that do it, but the internet has a lot of information out there. So some medications you may currently be taking require special consideration and discussion. So you do have to really watch and discuss those with the doctor if you're wanting to try medical cannabis, especially some of the heart medications, the blood thinners, and just like anything else, some of the herbal supplements, there's certain things. So those would be things you'd want to discuss with that provider. Before you apply for a registry card, the doctor does have to be licensed in the state of Illinois. You yourself have to be a permanent resident in the state of Illinois, and you have to meet one of the qualifying medical conditions listed in the earlier slide. Our application process is completely online, and it is not iPad or mobile device compatible at this time. So you would have to apply online on a PC or a laptop. There are places you can go to get assistance. We keep a list of the local health departments in certain counties. We have a list of those that are currently involved in we call it our local health department reimbursement project. We do provide reimbursement to those people to help our patients apply. The dispensaries are usually a good place as well. The next slide just kind of shows you what it looks like when you get on our website. Providers create an account on our online registry system. The physician will assign and create the online certification, and then the patient does their part. And then as the patient, you would link the doctor certification to your application, and then we look at all of it together. We do also cross-check the provider's license and verify those through the IDFPR. I mentioned they were part of the overseeing of the dispensaries, but we also check those to make sure that the doctor has an active license in the state of Illinois to prescribe a controlled substance.